Good morning, my name is Dr. Scott Glocke. I am here doing a tip of the week from our new office space here in 219 US Route 1 in Yarmouth. It's been an absolute amazing experience for us to be here. If you haven't checked us out yet, check us out. We'll put some new pictures of our new office on Facebook. But what I wanted to do is talk about a few questions that a lot of parents have been asking the last couple days, and that's with ear infections. A lot of kids are having problems with blockage of the ears, or a lot of pain. Kids are crying in pain because they're having a lot of blockage or infection in the ear, either one side or both sides. And I want to talk about a research study that was done in the Current Opinion of Pediatrics. And what they did was they looked at what's the best treatment for ear infections from a medical standpoint, because a lot of times the number one cause of pediatrician visits is ear infection. It's very, very common. It's like 60 to 70% of their practice is designated to ear infections. And the one tool they do have is antibiotics. And one of the things that I want to talk about is and I'm quoting the authors here, is few issues in clinical medicine are as controversial as the efficacy of risks associated with antibiotic treatment of otitis media. It's best to avoid the antibiotic treatment dilemma as much as possible, if not overdiagnosing otitis media. So they're looking at the antibiotic treatment for otitis media, saying it's probably not the best realm of treatment. So what is the best treatment realm for a child who is screaming in the middle of the night, has a blocked ear, has got a lot of inflammation, and there's a parent is just really concerned and frustrated? And that's where the neck comes into play. The neck, the brain is encased in a fluid, and that fluid drains down through the spinal cord, through the system, and it bathes all the spinal systems. If there's a small displacement of that upper neck area, it can cause a blockage of a lot of the fluid that drains from the brain. Also, there's a muscle deep inside the ear, and that muscle, you can't feel it, you can't really massage it, anything like that. It's very common, the muscle, when you yawn. When you're in an airplane and you yawn and you feel your ears pop a little bit, that contracts that muscle deep in there. But that muscle, what it does is it allows for the drainage of that ear canal. And if you have an upper neck misalignment, a subluxation of that upper neck, it causes a contraction of that muscle, and that causes a blockage of that area. By getting that upper neck adjusted, it allows for everything to drain right. Because in children, the ear canals are more horizontal, versus as they start to get older, they start to become more vertical. So they drain a lot easier as they start to get older, which is why a lot of times children usually are the ones that get the ear infections. So the best method for handling ear infection is making sure that upper neck is properly adjusted and analyzed. That's one of the things that we do here in the office. So I hope you enjoy this tip of the week. Please pass this on to others. If you have family members or friends that are having children with a lot of ear infection and infection problems, call our office, 846-5100. We help them tremendously. They respond very, very well without the use of antibiotics. All right, I hope all you are well, and Happy New Year.